Hello, everyone, and thank you for joining us. Today, I would like to welcome Angela Inglis, who is a genetic counselor and a clinical assistant professor in the Department of Psychiatry at the University of British Columbia. Angela has worked in psychiatric research for a number of years, coordinating and overseeing research programs which involve studies in postpartum depression, stigma among family members of individuals with psychiatric disorders, and a genetic counseling study for individuals with psychiatric disorders, schizophrenia, bipolar disorder, and schizoaffective disorder. In 2012, Angela began providing clinical genetic counseling services exclusively to those with psychiatric disorders and their families in the context of the first and only clinic of its kind in the world at the BC Women's Hospital and Health Centre. This service is for both men and women who are interested in learning about what might have contributed to the development of their own mental illness or that of their child, sibling, parent, etc. It is also for people who are interested in learning about the chances of other family members developing a mental illness. Within this talk, she will discuss the data and outcomes from the clinic. It's really wonderful to have you with us today, Angela. Welcome.
Thank you so much, Debbie, and thank you for inviting me again to speak this year. So I'm going to be talking to you all today about genetic counseling for psychiatric illness. I work as part of the team, so some of the slides that I'll be presenting to you today are from my colleague, Dr. Janine Austin. Oh, there we go. Great. Sorry. If you'd like to tweet during the presentation, I strongly encourage that. So this is my personal handle as well as the handle of the clinic that I work for. So I'm going to run through a number of objectives with all of you today, but I wanted to first kind of start off by talking about what we currently know about the genetics of psychiatric disorders. This might be review for some of you, but I know that we have a lot of people joining come from different backgrounds. So I think it's really important that we just start off by establishing that genetics do play a role in the development of psychiatric disorders. So it was noticed about 500 years ago that relatives of individuals with psychiatric disorders and mental illness had a higher chance than the general population to develop a similar problem. More recently, this was formally studied through family studies. So what we always notice with family studies is that a family member of an individual with bipolar disorder has a higher chance than the general population of developing bipolar disorder or a similar problem. So this might make you think, well, then that shows evidence that genetics plays a role in the development of bipolar disorder. But we know that families also have a shared environment, so perhaps it's this shared environment that actually contributes to the development of bipolar disorder. So another way to kind of tease apart genetics and environment, another really good way of doing this is by looking at twins. So a bunch of twin studies were conducted. So there are two types of twins. There are identical twins who share 100% of their genetic information, and non-identical twins who share about 50%, or about the same as regular siblings. If a condition is completely genetic, we would think that we would know that if one twin had that particular condition, 100% of the time that their identical twin would also have that condition. So doing twin studies is a really good way to sort of tease apart that genetics and environment. So you would think that if bipolar disorder or schizophrenia or depression or panic or any sort of mental health problem, if it was completely genetic, that 100% of the time an identical sibling would also have that mental illness. But that's not what we see. So in particular with bipolar disorder, only about 70% of the time does their identical twin also have that bipolar disorder. So another good way to kind of tease apart genetics environment is comparing the rate between identical twins and non-identical twins. So we can see that the rate with non-identical twins is actually much lower than identical twins, and so that shows us that genetics do play a role, but it's not the complete picture. So that shows that environment must also be contributing. So I also really just wanted to briefly touch on heritability. I know that there's a lot of misunderstanding with this concept. Often people come into the clinic and they'll have seen these numbers on the internet. So for example, they might see 70 to 85% of bipolar disorder is heritable. And that might make them think, well, 70 to 85% of my bipolar disorder is genetic, and therefore my children have a 70 to 85% chance of developing bipolar disorder. And this is not true. That's not what these numbers mean. So heritability is a statistical concept, or a statistical term, and it's a statistical measure of the degree to which the variance in a trait across a population is attributable to genetics. So it's a population concept, and it means nothing at the individual level. So for example, it's sort of similar to Stats Canada. So say Stats Canada says that the average family has 2.4 children. Well, I don't know anyone who actually has 2.4 children. And of course, this number doesn't mean anything, again, at that individual level, because some families will have no children, and some families might have 10 children. So broadly, what we know about genetics is relevant to mental illness is that they run in families, they are highly heritable, but the cause is heterogeneous and most often complex, meaning genes and environment. Some genetic variants have been implicated in cause, but we don't know all the genetic variations that can contribute yet. Individual genetic variants are associated with rather than causative of illness. So it's not that somebody would have a gene that would cause them to develop bipolar disorder. We know that there are some genes that are associated with bipolar disorder. And often these genes are associated with bipolar disorder, schizophrenia, depression. So it's not that if you have a particular variant, that means you have a higher chance of one condition over the other. Many environmental factors at this point have been implicated, or life experiences. So these are going to be anything really that a person perceives as being stressful. So it can be very individual from one person to the next. But some of the ones that we do know are from research are having a childhood head injury, or immigrating from one country to another, or we don't know why this is, being born in the winter month. And of course, none of these cause somebody to develop a mental illness or bipolar disorder, because lots of people immigrate and lots of people are born in the winter months and don't experience mental health problems. But we know that they have been implicated, so it just can increase somebody's chances. So right now, there's no genetic tests with which to diagnose a psychiatric disorder. So it's not that somebody would go for a blood test and then that blood test will tell them they have bipolar disorder. It's still, the diagnosis would still be coming from your psychiatrist. Family history at this point, family history evaluation, is more useful than any genetic testing for predicting risk for psychiatric illness. In rare cases, genetic testing can make sense, but often people have other medical problems as well as psychiatric problems. And I think the best example of this is DeGeorge syndrome, or 22q deletion syndrome. And so people with this condition often will have other things going on, and other things going on in the family. So there might be heart defects, learning difficulties, they might have a high arch palate or hypernasal speech. They also have a 30% chance of experiencing psychosis or schizophrenia. So mental illness is caused by genes and environment. And I think it's really important to note that these genetic differences that contribute to mental illness are best referred to, again, as susceptibility, vulnerability, or predisposition genes. They're not causation genes. In general, mental illness is not inherited, so it's not that somebody would pass on bipolar disorder or pass on schizophrenia, but one can inherit a vulnerability to it. And so why is this important? This is important because as human beings, we really like to understand why things happen. And I think historically, we haven't been the best at conveying this information that it's caused by genes and environment and how that might fit with somebody's particular situation. And why this is important is that, we like to know why good things happen to us, why bad things happen to us, because when we can find those explanations, that gives us that sense of control. And that's very much true for mental illness. So people like to understand why they've become sick. So you can imagine, for example, say you're driving along and you get into a car accident. You'll often want to look back and say, well, what led up to that car accident? Why did that happen? Well, perhaps I was texting while I was driving, and that's why that bad thing happened of me getting into the car accident. And again, that's very much true for individuals and family members of people with mental illness. They want to understand why that happened. In the absence of an explanation, and an explanation that makes sense to their own particular circumstances, people often look for their own explanations, and these can often invoke a lot of feelings of shame and guilt. And this is actually something that genetic counselors are really good at addressing. But I first want to just kind of provide a few examples of this. So this is a quote from a father of a child with bipolar disorder, and he says, "It came from my side. I've got the guilt. If I hadn't had him, he wouldn't be like that. If I'd known more at the time, I probably wouldn't have had any children because what I've seen happen to him. I didn't think about this being passed on when I was 23 years old. Do you think, this will never happen to me? I would have made different decisions if I'd known." So you can see he's feeling very much like he's caused his child to develop bipolar disorder, or he's passed on bad genes, which we know isn't true. We know that bipolar disorder is brought about by a combination of genes and environment. Similarly, a mother of a child with Asperger's syndrome said, "The feeling that we somehow caused this is strong. This happens because we are judged harshly due to our child's behaviors. I was lectured by family members about her parenting skills." And I know this is a mother of a child with Asperger's syndrome, but you could easily replace that with a mother of a child with bipolar disorder. So again, both of these people are experiencing feelings of shame and guilt, and this is something very much that genetic counselors are very well trained to address. So you might be wondering kind of what genetic counseling is, or how it can help in the context of psychiatric disorders and what that looks like. So I'm just going to run through that with you. So genetic counseling, I think, is often thought of as a healthcare provider providing information around cause of disease, or providing information around genetic risk. And it's typically thought of as being quite a short conversation. So mental illness is caused by genes and environment, and the chance for your children to develop it is this number. So genetic counseling is actually a specialist healthcare discipline in its own right, and it is defined by the National Society of Genetic Counselors as a process of helping people understand and adapt to the medical, the psychological, and familial implications of genetic contributions to disease. And you can see that genetic counseling really fits with mental illness, as there is that genetic contribution to the development of psychiatric disorders. And so I think sometimes too, then people think, oh, well, then you're just going to be talking about that genetic component of mental illness. So in the context of complex disorders, we talk about cause of disease or cause of psychiatric disorders holistically. So we talk about both the genetic and the environmental components. I think also it's often people think of genetic counseling being the same or kind of equated to genetic testing. So while it is a really good idea, if you want to have genetic testing, you should see a genetic counselor to discuss those pros and cons and the implications of receiving a genetic test. Genetic counseling is extremely beneficial on its own. So there are two key informational components to a genetic counseling appointment, specifically for psychiatric disorders. So helping people to better understand cause of illness, as well as how that relates to recovery and reducing risk. Also helping people to more accurately appreciate risks for other members to be affected. So this isn't a quick chat. So it's often thought of as being a quick chat. It's not a quick chat. We often talk with people for upwards of 1 to 2 hours. And the information that's being presented is not neutral. It can evoke powerful emotions. So this all unfolds in the context of a supportive counseling interaction. So just sort of to demonstrate how genetic counseling can help, I wanted to present a couple of stories, or 3 stories, for you today. So the first one is about a participant, and we will call her Jane. Sorry. And Jane met with my colleague, Dr. Janine Austin, in the context of a genetic counseling research study. So Jane had, when Jane came in to meet with Janine for genetic counseling, Janine commented how struck she was by how empowered Jane seemed. Jane was very open and out about having bipolar disorder, such that people at work were aware that she had bipolar disorder, and they wrote about her in the newsletter. So she had quite a high-powered position. So they wrote about, Jane is doing so well in our company, and she also has bipolar disorder. So one of the things we standardly ask people in the context of genetic counseling is what they feel caused their mental illness, or what was going on for them around the time they first became sick. So when Janine asked Jane this, so what do you think caused your mental illness? Jane said for her, it was genetic. And he said, okay, so what was going on for you around the time you first became sick? And Jane shared this laundry list of all of these awful things that happened to her around the time leading up to her developing bipolar disorder. And Janine said, okay, well, do you think any of that could have contributed to you developing bipolar disorder? And Jane said, yes, it was a really terrible time, but for me, it was all genetic. So Janine started going through the explanation of how it's both genes and environment, or experiences that can contribute to someone developing bipolar disorder. And as she was discussing this with her, she noticed the color starting to drain from Jane's face. So she stopped and checked in and said, sort of, what's going on for you here? And Jane said, well, if we'd known there was anything other than genetics going on, well, I wouldn't have told people. They would blame me for being sick. And Janine, of course, very worried that she may have crushed this very empowered woman, said, well, first of all, those things that you had shared with me, those were things that were outside of your control. Nobody would blame you for those things happening. And also, because we know it's not all genetic, there are things that you can do to help with your recovery and help protect your mental health. So one of the things I haven't shared with you about Jane is that while she was very open and out about having bipolar disorder, her mental health was actually quite poor. She wasn't doing much. She had been on the same psychotropic medication for several years, and it really wasn't doing much to manage her symptoms. She had sleep apnea, which of course with bipolar disorder is not great, and she really wasn't getting very much exercise and was overweight. So Janine was trying to show her that there were some things that she could do to try to help with her own personal recovery and mental health, but didn't really feel like Jane was taking any of it in. So because this appointment was unfolding in the context of a research study, they'd contracted at the beginning that a research assistant would be coming in to finish some questionnaires with her. So Janine was saying goodbye and shaking her hand, had her hand on the door handle to leave, and Jane said, well, if we'd known it was anything other than genetic, we would have had more children. And started to cry. Janine tried to stay and talk with her more about it, but felt the only reason why she told her that was because she knew that Janine was leaving and the appointment was done. One of the things we standardly do is a 1-month follow-up telephone appointment. But of course, if we ever feel like someone's been upset by a genetic counseling appointment, we follow up with them much sooner. Well, Jane was actually in touch with Janine before Janine could even get in touch with her, and sent her an email saying that she had actually got herself a new family doctor, one who was more willing to work with her on her sleep apnea. She had switched her psychotropic medication and found the new medication she was taking was actually, she was already noticing was actually improving her symptoms. She was looking for a new psychiatrist, or for a psychiatrist, as she didn't have one, and she'd started going for daily walks. And she said she noticed that her mental health was the best it had been in several years. The other story I wanted to share was about Bob. And so Bob also met with Janine in the context of a genetic counseling appointment. And Bob was currently in hospital for a recent suicide attempt, and he had a diagnosis of schizoaffective disorder. And so when Janine met with him, just as they were kind of getting to know each other and chatting a little bit at the beginning, Bob shared that he'd actually had a master's degree in the genetic variants involved with schizophrenia. And that's what Janine had done her PhD in, so they had a great chat about that. And out of habit more than anything, Janine asked him, so, what do you think caused your schizoaffective disorder? Assuming he would say genes and environment. And without skipping a beat, he said, poor life decisions and weak character. Janine said, well, what about that master's degree you did in those genetic variants? Bob said, well, yes, I see how that's true for other people, but for me personally, it was poor life decisions and weak character. One of the things we standardly do with people when we meet with them is a 3-generation family history. So when Janine took that from him, Bob shared that his father had bipolar disorder and his mom had recurrent depression. So as Janine was able to show Bob as she went through the family history that he likely would have inherited some genetic variant from both of his parents. And when she went through that with Bob, he broke down and started to cry and said it felt like the first time in several years a weight of guilt had been lifted and that perhaps it wasn't all his fault. And one of the things I haven't shared with you about Bob is that the reason that he was still in hospital was that because he'd been fighting with his psychiatrist because he didn't want to take his psychotropic medication. So when Janine followed up with Bob a month later, he said that once he understood that there was a biological component to his personal disease, a biological treatment made so much more sense to him. So he'd stopped fighting with his psychiatrist and was starting to take his medication. So you can see for both of these cases the importance of understanding cause, both the danger of thinking it's all genetic and how it can be detrimental to think it's all environment, and how important it is to address these with people. The last story I wanted to share with you quickly is about a person we'll call her Jane, and I met with Jane in the context of our psychiatric clinic. Jane had come in to talk about her adult son who had bipolar disorder. And it became apparent as we were chatting that she was currently experiencing depression. And so we had talked a few times about the importance of healthy habits, so trying to eat well, trying to get good sleep, social support, trying to get exercise, all of those things. But it wasn't until around about the 2-hour mark, so we've been talking for a while, that she said that she didn't really see a point in doing any of those things because they didn't change her situation. She wasn't able to do them because she was feeling so stressed and feeling depressed. And so we talked about how it was actually really important for her to try to do some of those things for herself because she is living with a constant stress of worrying about her son, and she is currently feeling depressed. Trying to do those things can really potentially help with her recovery or just help maintain her mental health. And as we were going through that, she said that she'd had an epiphany. She shared that other people had talked to her about this before, but it was the first time that it actually resonated with her. And she shared again that she hadn't really seen, she'd really enjoyed yoga and she'd really enjoyed going for runs, hadn't really seen the point in doing these activities because they didn't fix her situation. She started to cry and said that she'd been called selfish by family members when she did sort of take this time for herself. But now that she sees how important it is and compared it to like being on the airplane and when they drop the oxygen mask, how you're supposed to put that oxygen mask on yourself first before you help someone else. She said, because if you can't breathe, how are you supposed to be a support person for someone else? So we spend a lot of time talking about helping people to better understand cause, as well as how that relates back to recovery and reducing risk. But we also do talk with people about what risks might be like for other family members, because that is a question that people sometimes have. So you might be wondering, why is this important? So risk perception is important. And we kind of showed this through a survey we did several years ago. We had, sort of along the x-axis, we asked people who had a first-degree family member with psychosis what they thought the risk was for somebody who had a brother or a sister with psychosis to develop psychosis themselves. And so that's what you see along the x-axis, is what they thought that risk would be. We then asked people if their personal family history of mental illness has affected their decision to have children. And for those who said yes, we asked them by how much. And so that's what you see along the y-axis. So the star over the 10% is in the quotation mark correct answer. So as you can see, as people overestimate that risk, so as they think that risk is higher than what it actually is, the less likely they are to decide to have children. And while not everyone wants to have children, and it's a big life decision, people should be making that decision based off of the best information possible, or most accurate information possible. The reason why I say that 10% is sort of in quotation marks the correct answer is that 10% doesn't take into account someone's personal family history and someone's personal age. So you can imagine that if somebody has 3 generations of psychosis, that 10% number is actually going to be a lot higher. Versus if if somebody comes in and they're 50 years old and they have a brother or sister with psychosis, they've passed that usual age of onset, so their risk is going to be a lot less than 10%. So how we perceive risk is a very individual experience, and it really does depend on how we view the development of bipolar disorder or schizophrenia or depression. So there had been some talk in the literature that it's too hard to really kind of personalize those risks, where people have a hard time conceptualizing it. So perhaps we should just put it into context for them. We should just say it's low, moderate, very moderate, high. But you can imagine for one person, if you were to tell them they had a 10% chance to develop schizophrenia, for them, they might see that being based off of their experiences with schizophrenia. Perhaps for them, that's like saying there's a 10% chance tomorrow there's going to be snow flurries. Perhaps they see that as being low, and see it. There's a 90% chance that they or their child won't have schizophrenia. If you were to tell somebody else that it's a 10% chance for them to develop schizophrenia, for them that might be like saying tomorrow there's a 10% chance of a Richter scale 9 earthquake. For them that might be huge. So I've kind of already touched on the numbers out there don't take into it can be misleading because they don't take into consideration your family history. So something that genetic counselors can do, or are well trained at doing, is taking a very detailed family history, and they're able to personalize that risk for somebody. So based off of the information that, genetic counseling, there's been research done to show that genetic counseling is beneficial for people and family members of people with psychiatric disorders, and that people with psychiatric disorders want to have genetic counseling. And based off of the fact in British Columbia, people were not receiving this service, we actually started up a specialist service in February 2012. And we started up the specialist service to kind of reduce those barriers, to ensure that people who are wanting to receive this service would have access to it. So it's a free clinical service for all British Columbia residents. We do appointments in person, over the phone, via outreach, video conference. We have access to interpreters. We accept referrals from all healthcare providers, as well as self-referrals. And again, this is just to try to make it access as easy as possible. And we write consult letters back to all referring healthcare providers. So as I mentioned, we always take a detailed family history. And we usually do this over the phone before we meet with somebody. And this is because they can be lengthy and they can be sensitive. Sometimes we are talking about a family or personal history of hospitalization or suicide, so it can be emotional. Appointments themselves are about 1 to 2 hours in length, so this is not a short chat that we're having with somebody. We standardly do 1 month, or approximately 1 month follow-up phone call. There's always the option of coming in for more appointments if somebody has more questions or they want to discuss things further or bring in other family members. And most patients will complete a clinical assessment tool at the beginning of the appointment and then again at the 1 month follow-up time point. And that's so we can establish some issues for discussion as well as get a sense of how that person is doing. So there's 2 tools that we use. The first one is the Genetic Counseling Outcome Scale, and this one is completed by all patients, and it measures empowerment. It consists of 24 questions, and it's rated on a 7-point Likert scale. So it asks questions like, I feel guilty because I might have passed this condition on to my children, or I don't know where to go to get some medical help I or my family needs. So again, sort of getting that sense, does this person need to be helped getting connected with resources, and should we be addressing guilt right away? The second tool we use is the Illness Management Self-Efficacy Scale. It's completed by patients with a personal history of mental illness. It measures self-efficacy and consists of 9 questions, and it's rated on a 10-point Likert scale. And it asks questions like, how confident are you that you can do the different tasks and activities needed to manage your health condition on your own between visits to your healthcare provider? And again, trying to get a sense of how is that person's self-care, coping mechanisms, and how are they doing right now. Okay. So I just want to quickly run through the outcomes from our genetic counseling clinic. So all the patients who attended our psychiatric genetic counseling clinic who were eligible, meaning that they could speak English and weren't currently experiencing psychosis, were asked for consent to allow us to use their clinical data for research purposes. So their clinical data, meaning we looked at their chart notes and the clinical assessment tools to examine demographics, their primary reason for coming into the appointment. So this is something we would always ask when doing that telephone call to do family history. And then we also looked at the scores from the 2 assessment scales prior to genetic counseling and 1 month after, and analyzed them using pair t-tests. We also looked at patients' perceptions of the value of coming into the appointment. So over the course of the year, we saw 143 patients. 75 were eligible and consented to allow us to use their clinical data for research purposes. Most were women, had self-referred, were European, and had a personal diagnosis of mental illness. So I think 10 participants had comorbid disorders, but we broke it down sort of to individual disorders to kind of get a sense. So 43% experienced depression, 39 bipolar disorder, 29 anxiety, 8% schizophrenia, and 4% other, such as OCD and borderline personality disorder. The majority of people came to the appointments on their own. The rest were what we called family appointments, so people came in either it was a parent and child, or couples, or siblings, etc. And most of the appointments were in person. So we asked people, again, that main reason for wanting to come into the appointment, and often people would supply more than one answer, so you notice this does not add up to 100%. So 58.7% wanted to understand causes of mental illness, 21.3% wanted to understand ways to help protect mental health, and 64% wanted to understand recurrence risks. So 52% for children, 5.3% for themselves, and 10.7% for others, such as grandchildren, nieces, and nephews. And there's a little asterisk beside child and self because 3 participants wanted to know for both themselves and their child. So we looked at the results from the genetic counseling outcome scale. So along the y-axis, the higher the number, the higher the scores of, or the higher the level or scores of empowerment. So we found that there was a significant increase 1 month post genetic counseling of empowerment, which was great, which is fantastic. Then we looked at the self-efficacy scale, and again along the y-axis, the higher the number, the higher the scores of self-efficacy. And so this was just completed by those individuals with personal history of mental illness. And we saw 1 month post-genetic counseling, there is a significant increase in self-efficacy. So just quickly, I just wanted to share the story of a participant who came in. She had experienced a lot of feelings of guilt around her family history of bipolar disorder. So she had a family history of bipolar and depression. She herself had any experiences of mental illness, but her daughters also had bipolar disorder and depression. And she felt very much, due to her family history, that she had caused her daughters to develop bipolar disorder and depression. When I followed up with her at the 1 month time point, and I asked her that question about guilt, that says, I feel guilty because I might have passed this condition on to my children, she said, one, strongly disagree. She shared that she had felt guilty prior to genetic counseling, but afterwards, now she doesn't feel any guilt. She said that she was able to see more recently than when one of her daughters was starting to experience depression, that there were these external factors that were contributing to her daughter's depression, and these were things that she was not causing her daughter to feel. Another participant shared that she felt her children were not as doomed as she had previously thought. She understood that mental illness might be more likely, but they're not doomed. Another described how she now finds it easier to talk about with her kids and her other family members. She has more hope and less shame, realizes it's treatable, and worries less about passing it on to her kids. So it was a really quick run through of our results. We had recently published our paper, so if you're wanting to read more about our results and discussion, welcome to, so this is the title of our paper. So I hope I've shown you that genetic counseling is helpful for people, for families and individuals with psychiatric disorders, and it is ideally suited at reducing guilt and shame, and it can help people understand cause as well as chances for other family members and ways to protect mental health. So our clinic that we started up here has actually kind of been a bit of a training ground. So we've had people come, so Carmela Thompson came from, she's a genetic counselor in San Francisco, and she came and spent a week with me and is now offering a service in San Francisco for psychiatric genetic counseling. We also had geneticists come from Germany and a genetic counselor from the UK, and he's starting up a service there. So again, genetic counseling can really help people understand cause of mental illness, help people develop a more accurate perception of risk, and that can have a profound influence on life decisions. It's not a simple chat about information, and it's not a quick chat about chances for people to develop risks. And it can be really helpful for people with mental illness and their families. So you might be wondering, it's like, this is fantastic, I would like genetic counseling, or I would like to send my patients or clients for genetic counseling, and wondering how to find that in your area. So of course, if you're in British Columbia, you can call, well, it'll actually be my colleague Emily Morris. I'm on maternity leave right now, but you can, that's sort of our shared number, or send us an email. If you're in Canada, you can go to the Canadian Association of Genetic Counselors and look for a clinic in your area. So while we're a specialist clinic, genetic counselors are really well trained at, as I've talked about, at addressing these issues. So you can see genetic counselors elsewhere in Canada. Similarly, you can go to the National Society of Genetic Counselors. So that's the largest organization in the world. So this is our American organization. And you can go to Find a Genetic Counselor page and search for genetic counselors in your area. I think that's everything. Hopefully I didn't talk too fast, but I wanted to leave time for questions. Yeah, thank you.
Wonderful. Thank you so much, Angela. I do have a couple questions here. So let's start with, come back. Here we go. Do you think that or do you know of any type of service such as yours in the States? This woman is particularly in California, but
Carmilla Thompson in San Francisco.
okay.
So that webpage that I just showed you, she will do phone consults. So it is for cost. She does charge, but she does offer a sliding scale. So I think she does show her prices on her website, but I think she can negotiate based off of like everyone's financial situation.
Wonderful. Thank you for that. The next question is, let's see, what age do you think is appropriate my daughter is afraid to have children in her life. Her brother has bipolar disorder. She does not. At what age do you think is appropriate for her to receive genetic counseling?
I think I don't know how old she is right now, but if it's something that she's worried about and she's already at that place where she's saying, no, I'm not going to have children, and that might just be that she decides she doesn't want to have children. That's totally fine. But if it's sort of maybe needing more of that conversation around where these fears coming from, and maybe we know that people actually overestimate the risk, as I talked about. So I think really any age is appropriate. And I think it's just sort of based off, if she's a child, maybe trying to get that sense of, do you think like this is a conversation she's wanting to have? If she's already expressing those views, then maybe it would be helpful for her to speak with a genetic counselor, because it doesn't have to be a one-time thing. It can be something where, if she's open to it, she can go and have that conversation, and then if she's getting to a point where she's maybe thinking, maybe I do want to have kids, or I want to explore that possibility again because I'm at that age where I would be thinking about having children, she can meet with a genetic counselor again. So it doesn't have to be a one-time thing, and I think it can be beneficial at any age. We do meet with children. It just sort of depends on their interest. If they're completely uninterested, it can be hard to engage sometimes.
Great, thank you. It looks like we don't have any. Oh, here we go. Here's another question. Let's see. In the first generation of a family of 10 children, let's see, there is a 40% prevalence of psychiatric disorders, schizophrenia, major affective disorder, and bipolar. In the next generation, there is also 40% prevalence. The family believes it is genetic. How would you counter that belief?
Well, I think it's again taking that family history, and I think going through the fact, and it's talking about too that it's for everyone. Everyone has some genetic vulnerability to developing a mental illness, and I think that's often it's sort of like when all of a sudden you see it in one generation, you think, well, how did this happen? Where did it come from? It's just realizing that perhaps the generation above, they had some of that genetic vulnerability, but perhaps based off of their life experiences never went on to develop a mental health problem. So it is genetic. It is just that it's not completely genetic. It's genetic and environmental. So families, again, they have a shared environment, and so it's it does kind of get into having more of that conversation of, for those people, sort of what sorts of things were going on for them when they got sick, because people can have a very strong held belief around cause, and so it is having to be more of that conversation of, okay, well, for you it's all genetic, but let's find out what was going on for you around the time you got sick. Do you think those things could have contributed? And then kind of showing them that some of those environmental things can contribute. And so it is. We often do sort of challenge people's thinking, but it's very much a conversation that unfolds over that hour or 2 hours or however long that needs to take. I don't know if that helps.
Great, thank you. How can a parent reduce the risk of a child to develop mental illness?
That's a great question. That question comes up a lot. And I know it's something that parents are so worried about. We're worried, parents worry about everything. It's a hard job. I'm learning. So it really is those healthy habits, or those what we call protective factors. So talking and trying to model for kids and talking to them about the importance of trying to get good sleep, which of course is not always easy. Talking about mental health, having open communication, and sort of talking about how we're feeling. So we know talk therapy can be really helpful, so just having that in the home, just being able to talk about feelings. And then trying to encourage exercise, and that's going to be different from one person to the next. So for some people that's going to be running a marathon, or other people it's going to be going for a walk or going to the gyms, whatever it is that works well for that person. And trying to eat well, so trying to eat fruits and vegetables and all of those sorts of things. And talking to kids about staying away from drugs like marijuana or things like that, because we know marijuana specifically can, for some people, can contribute to the development of schizophrenia. So it's just just talking about all of those things with our kids. And also, if it's something that I'm particularly worried about, when they're kind of at that point where they would be interested, you can always bring them in for genetic counseling to have that kind of conversation. Sometimes it's helpful to have somebody else kind of reinforce those messages.
Excellent, thank you. Are there any written resources that you can recommend for educating people regarding genetics and psychiatric illnesses?
There are, I guess it depends on the context. So we have, but it's more that it's helpful in the context of genetic counseling. So when you meet with a genetic counselor, they have resources that people can take away. So it kind of goes through, just again, sort of what I talked about today about genes and environment and all of those sorts of things. But it's more meant to be complementary to genetic counseling. If it's for like a healthcare provider, Dr. Janine Austin's book, How to Talk to Families. Oh, let's see if I can. I'm in her office. I don't see it. I think it's How to Talk to Families About Mental Illness. It kind of goes through. But it's not really meant for clients or patients. It's more meant for healthcare providers, sort of how to convey that information. But that can also be really helpful. I think really, if you've got genetic questions, talking to a genetic counselor is probably the best first step.
Wonderful. Well, it looks like you have answered all questions that have arisen from your talk. If there's anything additional that you folks might think of, please send me an email, or you do have Angela's contact information. You can do that as well, and I'll be sure to get the question to her. And don't forget that this is recorded and it will be archived on our website, so that if you know someone who could not attend today, they can watch at their convenience. And it should be uploaded this afternoon. So thank you again, Angela. We really appreciate you sharing all your research and knowledge around genetic counseling and psychiatric disorders. It's been a wonderful presentation again.
Thank you so much for having me. And again, if you're looking for a genetic counselor in this area, or even if you can't find Carmela's information, please feel free to send me an email.